Imagine this is the last moment you know you exist. You are lying beneath the cold white lights of an operating room. A mask is placed over your face, or a clear liquid begins flowing into your vein. The anesthesiologist asks you to count backward from 10, 9, 8. You are about to say 7. Then suddenly someone is calling your name. The operation is over. 3 hours have passed. During that time, surgeons may have removed a tumor, replaced a joint, or repaired part of your body. But for you, not 1 second of those 3 hours seemed to pass. There was no darkness, no sensation of waiting, no empty space you can remember. There was only the moment you were counting, and the next moment, it was over. So where were you? Or perhaps the better question is, what happened to the person living inside that body? Before anesthesia, doctors often tell you, you are going to sleep now. It is the most comforting description of what is about to happen. But neurologically, general anesthesia is not the same as natural sleep. When you sleep, your brain remains active. It moves through light sleep, deep sleep, and REM sleep, while processing memories, regulating emotion, and monitoring the world around you. A loud sound can wake you. A touch can enter your dream. Even after a dreamless night, you usually wake with some sense that time has passed. Anesthesia creates something different. On an EEG monitor, an anesthetized brain does not become a flat line. It still produces electrical signals, but those signals no longer show the same coordination found in a conscious brain. Anesthetic drugs change how different regions communicate, synchronize, and respond to the outside world. You are not simply sleeping too deeply to wake up. The system that creates conscious experience is being directly disrupted. Think of your brain as an enormous city. One district processes vision, another receives sound, another stores memories, another controls movement. Other networks calculate where your body is in space. When you are conscious, these regions exchange information continuously. You do not see millions of separate points of color. You see a face. You do not hear vibrations in the air. You hear the voice of someone you know. Your brain combines color, shape, sound, memory, and emotion into a single event. Consciousness may not be hidden inside one secret location. It may emerge from the brain's ability to coordinate many separate systems at once. Anesthetic drugs weaken that coordination. Some regions remain active, and some sensory information may still enter the nervous system, but critical areas begin losing the ability to communicate effectively. The city is still there, and some rooms are still lit, but the most important bridges have closed. One of those bridges runs through the thalamus, a relay station buried deep inside the brain. Many anesthetic drugs alter communication between the thalamus and the cortex, making it more difficult for sensory information to become a complete conscious experience. Your ears may still receive sound, and your skin may still register pressure, but those signals are no longer woven together with memory, emotion, and a sense of self. The world is still touching your body, but your brain has stopped constructing a person who is experiencing it. General anesthesia often has to control several systems at once: consciousness, pain, movement, and memory. In ordinary life, these seem to come as one package. Biologically, however, they can be separated. You can be conscious without feeling pain, feel pain without being able to move, or experience something without forming a lasting memory of it. Doctors may use different drugs for different purposes. One to maintain unconsciousness, another to control pain, another to relax or paralyze the muscles, and others to interfere with the formation of new memories. The anesthesiologist continuously monitors breathing, heart rate, blood pressure, reflexes, and sometimes brain activity. Too little medication can allow a patient to react or become aware, while too much can create additional risk and make recovery harder. It is a delicate balance. These layers are not controlled by one switch, and they do not always disappear in the same order. This is where anesthesia awareness becomes possible. It is rare, but it is real. Some patients remember only fragments: a voice in the operating room, the sound of metal instruments, a pulling sensation, or a vague feeling of pressure. The memories can feel like sounds leaking into a nightmare. But in more severe cases, a patient may become aware while being completely unable to move or communicate. The muscle-paralyzing drug is still keeping the body motionless, but the medication maintaining unconsciousness may not have reached the necessary depth. Imagine waking up inside your own body, unable to open your eyes, lift a hand, speak, or tell anyone that you are still there. But the experience reveals something even more disturbing. Consciousness is not a single switch. A motionless body does not guarantee awareness has disappeared. A lack of response does not prove nobody is observing from within. Having no memory afterward does not necessarily mean no experience occurred. What feels like one unified human being is assembled from several biological systems. Anesthesia can pull those systems apart. In rare cases, control of the body can disappear before the person inside it does. Anesthesia does not only take away your ability to see, hear, or move, it also takes away time. A 30-minute procedure and a 5-hour operation can feel almost identical from the inside. The 5 hours do not feel fast. They simply never appear in your experience. To perceive time, the brain must create a sequence of experiences and store enough information to recognize that one moment has become another. Memory structures, including the hippocampus, are important to that process. Many anesthetic drugs do more than weaken awareness. They also interfere with the formation of new memories. A sound may have been processed for a moment, and a signal may have entered the brain, but if it was never connected to the rest of the system or stored as memory, you wake with no way of knowing it existed. That is why anesthesia feels so seamless. You do not experience a gap. You do not stand in darkness and wait. The system required to notice time passing is no longer functioning. From your perspective, there is no time in which to wait. Losing consciousness may not be as simple as a light switching off. As the drugs take effect, the brain's electrical rhythms change. Networks that normally exchange information in stable patterns begin losing coordination. Some signals slow down, some pathways are interrupted. The separate pieces of reality stop fitting together. This may help explain strange sensations some people report before losing consciousness. The feeling of falling, the room appearing to stretch, sounds becoming distorted, or a memory appearing and then dissolving. These may be the final moments in which the brain is still trying to construct reality, while the systems required to build it lose contact. A few images remain, a few sounds remain, but they are no longer unified enough to become a complete world. And then there is no observer left to see what happens next. Anesthesia can disrupt more than awareness. It can also disrupt the brain's model of where you are. Ketamine, for example, can create a dissociative state in which the mind, body, and surrounding environment no longer feel connected in the usual way. People may describe floating, watching themselves from outside the body, or feeling detached from physical pain. The important point is not that the mind truly leaves the body. It is that the certainty, I am located inside this body, must be continuously constructed by the brain. Disrupt the networks responsible for that model, and you may feel as though you have gone somewhere, even though nothing has actually left. When the drugs wear off, you do not return like a switch being flipped. Different brain functions recover at different speeds. Reflexes and movement may return first. You open your eyes, you speak, you answer a simple question. But short-term memory, judgment, and self-control may not yet be fully online. That is why some patients ask the same question again and again after surgery. Some begin crying over something trivial. Others say strange things with complete confidence. It does not necessarily mean their true personality has appeared. The brain is simply returning in an uneven order. Language is working, emotion is awake, the body has opened its doors, but the systems responsible for organizing and controlling everything have not fully returned. Waking up requires more than removing the drugs from the body. The brain must restore coordination between regions that were disconnected. The bridges begin reopening. Information begins moving again. At some point, the system becomes coordinated enough for a person to reappear, and that brings us back to the moment between 8 and waking up. So where did you go under anesthesia? Probably nowhere. Your brain was still there. Your body was still there. Your heart continued beating. Some neurons continued producing signals. But the systems that create a unified experience were no longer working together. Think of consciousness as a piece of music. The music is not located inside the violin. It is not hidden inside the drum. It does not exist in the conductor's hands. It exists only when every part works together at the right moment. If every musician remains on the stage but can no longer hear the others, individual sounds may still exist. The music does not. Perhaps you are the same. You are not a secret object stored somewhere inside the brain. You are a process the brain has to keep creating, second by second. When that coordination stops, you do not travel somewhere else. You temporarily stop being assembled. And when the connections return, you open your eyes with no memory that you were ever gone. The doctor tells you the operation is over. For you, only a moment has passed. But outside, an entire world continued to exist. Not because you had left it, but because, for a while, there was nobody inside your body to witness it.